After having spine surgery, we do have some patients who come back to us and tell us, "Sir, I'm much better. You fixed my back. My pain is gone, but still my feet feel something different. My feet are still numb. They are still dead." And these are usually those patients who had their feet numb even before the surgery. So why do they have numb feet or some funny feeling or weird sensation, what we call paresthesia or pain in their feet even after spine surgery? Let's discuss that in this video. Welcome to my channel Zen Spine English. My name is Dr. Rakesh Dhake. I'm a consultant spine surgeon working in Mumbai. So if someone has spine surgery, usually the surgery is done to remove the pressure on the nerves. So if you understand the pathology, when there is stenosis or when the nerves are compressed in the spine, that is when the patient gets radiating pain which starts from the lower back, goes down their buttock and down their legs and also in the feet. Sometimes these patients have feet pain as well, or feet numbness or paresthesia, what we call, or different sensation in their feet, along with leg pain and claudication. What claudication means is after walking for some time, like 5-10 minutes, they have to sit down. They feel better and then they can walk again. So this is claudication. Usually all these things are together. These patients have surgery if they're not better with medicines. Then after surgery, usually the leg pain or the claudication pain settles. The patients are able to walk better. They can walk for longer distances. Sometimes there can be some pain due to nerve irritation, which also settles down in few days or weeks. But what can persist is the numbness in the feet. And then these patients come back to us telling that they have numbness in the feet. But usually this is the discussion I have with my patients before the surgery, explaining them that this numbness in the feet can persist even after surgery. Let's look at the reason. Now, if you have, for example, a rubber band or a tight thread that you are tying on my finger with multiple loops around my finger very tight, and you leave it like that for weeks or months, and then obviously that is going to pain, but when you remove it, you will feel that relief, but the finger won't immediately become like this finger. So you will see some mark which may be bluish discoloration, blackish discoloration. There may be some indentation on the finger. So yes, for this finger to become like this finger, it is going to take time. Now, how much time? Now see, if a bone breaks, the bone unites. If your skin has an incision or a cut, the skin can heal back. But if your nerves have been compressed for a long time, or they get injured due to some trauma, the nervous tissue is the one which really takes long to heal, or sometimes the damage can be permanent. So these patients who have numbness in the feet are usually those patients who have waited for quite a long amount of time to go for surgery. Usually in countries like India, yes, the patient to come for surgery, it takes a lot of time for them because they are decision making, they are trying some non-surgical options. And by the time they come for surgery, it is too late and the nerves are so compressed that the damage can get irreversible. Sometimes these fibers can heal, and in period of some days to few weeks, it can usually settle like 6 to 8 weeks, but it can take years for large nerve fibers to heal. Sometimes it can be permanent, as I said. And hence, even after surgery, this numbness in the feet can persist. But remember, the pain you had before surgery, the claudication that you had to sit even after a few minutes of walking, that will be relieved to quite a good extent. Now, this is a balance that you have to take before the surgery. Obviously, if you don't get operated, this numbness is going to be there forever. Plus, there will be pain and claudication. But after having surgery, at least those things are better. But this numbness persists. So if you are expecting that you will be 100% all right after the surgery, no, that's not going to happen. It will make you better. It's not going to make you perfect. So the numbness might stay even after surgery. Especially if it has been delayed for many months or years, then yes, it is going to stay. Also, the other thing to note that few patients might have diabetes or other causes which may lead to neuropathy, meaning the material with which the nerves are made. The nerves itself get damaged. If the nerve is damaged because of diabetes or alcohol or vitamin B12 deficiency, then these patients can have what we call peripheral neuropathy. And in these cases, peripheral neuropathy itself is a cause independent of spinal cause to have numbness in the feet. So in such cases, no matter how well the spine surgery is done, the pain might resolve, the claudication might resolve, but the numbness or pain in the feet may persist even after surgery. Other thing to note is, if these patients had pain in their feet before the surgery, then it is very likely that they will have foot pain even after the surgery. So these are the few things related to foot pain or foot numbness that we usually discuss with the patients before surgery, and I usually give them the options to balance those risks and benefits of what you are going to get after the surgery. And if you feel the balance of both is reasonable choice for you, that is when we go ahead with spine surgery. I hope this video has given you an insight of why some patients might have numbness in their feet. But if you have some doubts related to this or any other spine related issue, you can write in the comment section below. We'll try our best to get back to you as we get time. And please do not forget to like and subscribe this channel. Thank you so much.